Hello, I'm Dr. David Hornbrook, the Clinical Director of Education and Technology here at Keating Dental Arts in Irvine, California. I'm also in private practice in San Diego, and I want to talk to you a little bit about things that I'm going to call them or put them in the category I would not want to live without. In practicing dentistry, I think the quality of care would be lessened or certainly not as enjoyable. The first one used to be called the wand, then it was renamed as the STA standing for single tooth anesthetic, and now it's called the wand again. And the nice thing about this, it's a computer-controlled anesthetic delivery device where you can deliver anesthetic very precisely and completely painlessly. The nice thing is we can do even our crown and bridge only numbing the tooth that we're preparing or treating. We give PDLs or we give infiltrations. It has a nice little handpiece. It has a foot pedal. The nice thing about the STA versus the original wand, it actually tells us, based on back pressure, whether we truly are in the PDL. Most of the restorations I do, even crown preparations, I give less than a quarter of a carpule. Only that tooth is numb. So when we're done with our visit, the patient only has a little bit of numbness around the tooth and doesn't have that lingering anesthetic from our typical block. The second piece of technology is my Picasso laser. This is a diode laser. I've been using diode lasers in my practice since 1995, and the original diodes were about $50,000. About 3 years later, they were $30,000. 5 years later, they were $15,000. We now have the opportunity to have a great diode laser, in fact, better than the one I had that was $50,000, in the price range under $4,000. I personally think every astute clinician that's practicing restorative dentistry in the United States or even worldwide should have a diode laser. My preference is the Picasso or the Picasso Light Plus from AMD. Great company, great support. All they do is make lasers. They'll be here for you. My third piece of technology is my scanner. I think digital impression is the future. In fact, it's the present and the future. You know, it's interesting how many dental labs really recommend digital impressions, how few dentists actually use them. You know, technology has always been so expensive because digital impressions was tied to a mill. So we're looking at $100,000+, and a lot of dentists did not want to mill their own restorations. They just want to take great impressions and utilize their existing laboratory or ceramics. The 3M True Definition scanner is the one I bought here in Keating, as well in my teaching operatory, as well as in my private practice in San Diego. It's affordable in the $16,000 range. It's very, very accurate. It's open architecture, which means I can send it to any laboratory anywhere in the world and they can accept my file and design the restoration. It can be used for Invisalign, it can be used for removable bridges, just about anything that you would take traditional impressions. And then we can either use it as a modelless restoration or we can provide traditional models that are very accurate epoxy models. The fourth piece of technology is my electric handpiece. And for those that have not gotten into the world of electric handpieces, you don't know what you're missing. It would be difficult for me to get back into the world of air turbine. Lots of them out there. I'm a huge Cavo fan. You know, the quality is unbelievable. This is my mainstay in my practice. I've got to make sure that it works as efficiently and as predictable as it can on a daily basis. Cavo has always been the go-to for me. The new Cavo handpieces are quiet. They're very well balanced, significantly shorter than some of the earlier electric handpieces we had. Great investment. The other nice thing about this is I don't need multiple handpieces. In one of the operatories in my practice, I have a slow speed, I have a high speed. Here at Keating, as well as the other operatories in my office, I have one motor. I can either have a straight cone, I can have a contra-angle, or I can have a high speed. Being electric, I just dial in the RPMs I want, move forward. Lastly, and this is my newest toy, is my Light Touch Erbium YAG laser. This is made from AMD as well. AMD lasers, if you want to see their portfolio, go to amdlasers.com. This is a hard and soft tissue cutting laser. So I can do gingivectomies, I can do ovaponics, I can do everything that my diode does, but I can also do hard tissue, being enamel, being dentin, being osseous. So I can do incipient lesions, class 1s, class 2s, class 5s, class 3s. I can remove existing composites, like taking out butter, most of the time without anesthetic. Also, crown lengthening. I don't lay flaps, I'm just not good at it, and place sutures for traditional crown lengthening. I used to refer those out to the periodontist. What I do today is I do what we call closed flap osseous, where I actually can take the tip of this handpiece, put it into the sulcus, and actually remove bone. So I can remove soft tissue, I can remove bone, reestablish my biological width, and I can actually prep and impress the same day. Again, this new handpiece, the nice thing about it, it's very flexible. Most of the erbium yags on the market, not only are they 2 to 3 times as expensive as this unit, but the laser is actually in the cable itself, so it's like wrestling with an anaconda. The laser itself is in the handpiece, so it's very light. I don't have to worry about bending the cable, running over it. Handpiece is at 60 degrees, more like our handpiece that we'd prepare a tooth with, versus some of the handpieces with the erbium categories that is 90-degree angle like a surgical handpiece. So I hope you enjoyed that. You know, we'll do an update on this as I get new toys or fun things or pieces of technology in my office. But those are things I would definitely look for. The STA or the wand from Milestone, no way I would live without this. Nice thing about it, when I cement my anterior restorations, let's see my smile design of 8 to 10 veneers, I give palatal injections completely painlessly. So the patient only has about a carpal of anesthetic total for 10 veneers, and they leave that day having full control of their lips. The Picasso or the Picasso Light, my diode. The problem with the diode laser is once your hygienist gets hold of it, it'll be her or his laser, because I truly believe it's a standard of care in periodontal treatment. The TrueDef from 3M, the future is here, we need to embrace it. And then lastly, my light touch laser. If you're ever in the Irvine area, Southern California, we're only 5 miles from Disneyland, 5 miles from Newport Beach, give us a call at Keating Dental Arts or visit our website at keatingdentalarts.com. I'd love for you to stop by and you can see the technology in person.